Thank you so much for taking the time for this interview, Dr. Mardones. And for those tuning in, welcome to this Scholastica Customer Highlight for Open Access Week 2022, themed Open for Climate Justice. Today, I have the pleasure of speaking with Dr. Fernando Mardones, Assistant Professor at the School of Veterinary Medicine at the Pontifical Catholic University in Santiago, Chile, and a Senior Editor for Advances in Global Health. Advances in Global Health is a transdisciplinary, fully OA journal focused on health equity that was launched by the University of California Press in collaboration with the UC Global Health Institute in April of 2021. It's also one of the first publications to be framed around the UN Sustainable Development Goals, which is very cool. During this interview, we'll be discussing how Advances in Global Health is approaching the nexus between global health equity and climate justice, and how the editorial team is continuing to develop the journal around the UN SDGs. So to start, Dr. Mardones, would you like to share a bit about your work and how you became involved in Advances in Global Health?
Hi, Danielle. Thanks for the time for having this interview and conversation about our journal and a specific section that I manage, the planetary health. I got invited. I'm a UC Davis alumni in epidemiology. I'm a veterinarian. And at Davis, we got a lot of training on understanding on how the complexity around animal health also involve human health and ecosystem health. So when I learn about the journal, I get to know these editors and start to see the possibility of launching also a section of planetary health. And I was also, I'm well connected. And so we created some sort of a network of different editors from different disciplines that we have now our section ready to go. And the idea we can discuss later on, but the idea is trying to bring some specific SDGs, how they relate and how they are affecting us in human health, animal health, and also the planetary health. So the idea is trying to capture attention on that, focusing also in middle and low income countries situation on the planetary health.
That's so interesting. And really the way that the journal is bringing together different disciplines and looking at those connections is, I think, such a different way of approaching scholarly publishing, and so incredibly important, given that I think as everybody is becoming increasingly aware, these are all very interconnected things, and we can't sort of solve one problem without considering the bigger picture. I am very excited for this interview because we did also have the opportunity to speak with Advances in Global Health's EIC, Dr. Craig Cohen last year for an Open Access Week highlight interview. And I know at that time, the journal was still relatively young, launched in April 2021. So now it's been a little over a year since Advances first launched. And we did that highlight. Can you share a quick update on the journal's progress to date and how you've been framing it around the UN SDGs, sort of like how has that developed?
Yeah, so the first thing that we did was to, as I mentioned before, having a bunch of different editors from different disciplines around the world. And we have people from the UK, Africa, Southeast Asia, South America. So the idea is trying to each of us bring the attention and to capture some of research going on in different regions of the world. The idea is trying to actually target those initiatives or researchers that are working on a transdisciplinary approaches for our health. We received the first publication, so we are happy to, it's under review. But also we had last month an opportunity to having a workshop partially funded by the OCDE. It was in Chile, it was in presence, one of the first workshop in presence, and we brought here about 15 different experts around the world, some of them from our editorial group. We were doing some brainstorming and covering some strategies that we can get more strong into the bringing attention for our journal and getting submissions. So we are really ready to go, and this is going to be launching soon some spatial collection on some specific topics.
That's very cool. And so in this meeting too, you were also seeking articles at that time. Were you able to get some submissions?
Yes, some of the participants they will be submitting with the local researcher team that they are working with young researchers in Syria, in Bhutan, in Peru. So the idea is try to really be more democratic about what's going on around the world with some common problems, but they haven't really show or presented in a scientific way. And sometimes you need to be very collaborative, trying to see those problems or issues and be collected in our journal, for example. We live in a world where in the past, most research about these topics has been concentrated in the, North America, Europe, first developed countries, and we are missing a big part. And what we want as a group of this new journal is bring young researchers from low and middle income countries and to show to the entire community there are also big important issues going on in those regions.
As you're looking for articles, can you share a bit about the sort of kinds of transdisciplinary research you're seeking and how climate change factors into that mix? Maybe if you have examples of any articles that you're excited about, or just kind of generally the types of research you're seeking.
Yeah, one of the things that we are looking for are those new diseases or emerging diseases that are often showing up in our planet. And this is the consequences of many different factors, mostly because of human behavior in our planet. Climate change is one of the most clear example of the impact of the humans in our planet, but that also brings some modification in terms of biodiversity, the declining of the wild population of animals that poses a risk for the emergence of new diseases, the movement of animals and people around the world, the importance, for example, of how we can secure food for an increasingly growing population of humans, and those kind of things that are really interconnected. I mentioned the example of One Health. One Health is really one of the new approaches that capture transdisciplinary and multisectorial approach for understanding the complexity of health, not only human health, but also animal and ecosystem health. One Health, for example, is so important that today the World Animal Organization, the Human World Organization, the FAO, and the Environmental Program of the United Nations come up with this new concept that they get together and make a call for the government to have a One Health approaches for tackling new diseases. Antimicrobial resistance, for example, is another example of where diseases are so prevalent around the world that you use antimicrobials. The consequences of that is that you also are generating antimicrobial resistance, super resistant bugs, and that affect us directly or indirectly. The impact of climate is also important. You see how all the climate changes in terms of flooding, drought, and that impact in the environment is very clear, and we see that as an opportunity to see what kind of research are doing right now and can be more effective than one simple silo, right?
Absolutely, that's really interesting. And when you talk about One Health, can you share for any unfamiliar a quick overview of what that is?
The One Health.
Yeah.
Yeah. So One Health is a holistic approach where you bring different disciplines in terms of an interface, in the interconnectedness and the connection between human, animal, and environmental health. They all share most of the time similar risk factors. So the idea is, instead of a veterinarian working alone tackling a specific animal disease, that sometime can be zoonotic, that means that is able to infect humans. At the same time, there is an MD or a doctor working just focusing on the human case for the same disease. And also an ecologist or biologist are working alone, on the ecosystem driver from the distribution or the pathogen in the environment. So here is, why don't we bring together all those expertise and make better solutions for the same problems, but be more efficient in such approach? So we bring knowledge together, expertise, stakeholders, and also that include social sciences, because at the end, many of the impact that we have today on health are driven by behavioral systems that we are facing today.
Absolutely. The idea of bringing together all of these different types of researchers and perspectives is so cool. And I think also what you mentioned of not only the people doing the research on these different emerging areas, but then also those that are more in the arena of communicating that and being able to move like public policy and behavioral changes, which is such a big piece. That's very interesting. And I know in our last interview with Dr. Cohen, he noted that you decided to focus the journal on a set of 3 SDGs when it first launched. Of course, trying to cover all of them would be very difficult, I imagine. Can you share a bit about why you chose to include planetary health in that initial list, and if and how your focus has changed as the journal has developed?
Yeah, the 3 that you mentioned, Danielle, is the SGD 13, which is climate action. The 14 is life below water, and the 15 is life on land. All right. So they are all, very connected. When we say life below water, we are thinking also on ocean health. And ocean health can be actually a sentinel of what is going on in our system too. Let's take an example of aquaculture. Aquaculture is the culture of fish or shellfish on the water, in the ocean. And it's become a new revolution of producing food for our planet. Okay, so moving from terrestrial to the aquatic. But that's very important because first, many livelihood depend on that. It's not only very intensive aquatic system, there's livelihood behind in Asia, in Africa, in South America, it's growing a lot. But the potential problem with that is that when you are farming those kind of fish or shellfish, you're also posing a risk because new diseases can emerge, and that can affect the environment, that can promote the use of antimicrobials or other chemicals. And that's something that we need to be aware of, that because it's at the end, it's going to affect us anyway. On the life on land, for example, this is something that we have facing for many years since we started the agricultural revolutions centuries behind. We now see the complexity of that and intensification of agriculture, or the change from wild lands to urban or agricultural, where there is more prevalent the single culture of one single species have an effect on the ecosystem as well. This is where you replace wildlife from one single animal, say a pig, a swine, or a poultry or cattle, right? You're changing that biodiversity, and that have an impact also in our ecosystem health, and all together brings into the climate action. So it's hard to see each of those SDGs separately. They are all very interconnected. Actually, there are some research that explore all the SDGs, and when you focus, for example, in animal health, sorry for saying too much animal because I'm a vet, but animal health pretty much touches in all of them, directly or indirectly. So, but we wanted to target those 3 because today are very relevant for our planet and in the concept of planetary health.
Sure, absolutely. And it is interesting that the SDGs, it seems like sort of since that has launched, the idea of thinking about things more holistically and not just in silos, that perhaps that has helped to sort of speed up that process, which is so critical at this point in time. And I know COVID certainly has, been a magnifier of that. I know also that one of the aims of advances in global health, as you mentioned, is to give prominence to knowledge from low and middle income countries, and also for early career researchers as well, to give them a platform. Can you share a bit about this and how you think it will contribute to equity in research related to the UN SDGs, including health equity and climate justice?
Yeah, absolutely, Danielle. It is clear that we are missing something important here. Many of the risk factor or potential pathogens come from regions that we don't know what's going on, and for example, I'm bringing you an example here of in terms of, again, a certain pathogen. It's in order to early detect a potential pathogen that can enter into our society and can make an impact, we need to establish some sort of surveillance, to look what is the pathogen, who is affected, where is the reservoir of the disease, and we are really missing that. We don't know. What are the burden of pathogen in some regions in South America, in Africa, in Asia. There are much more diversity, difference in culture, and if we don't understand what is behind on that, it's really hard to think in a in a sustainable planet. Now, we often have this mind of developed countries that everything is so well organized, and we have a system that is very clear in terms of traceability of animals or humans, and prevention by using vaccines. But this is not what's going on in our planet. We don't know sometimes how many animals are in some places. We don't know what kind of measure in terms of biosecurity or practices are doing. We need to describe those things. And worse even, we don't have sometimes the resources to do so. So we need to move. We need to be a stimulus for some regions on low and middle income countries that to encourage to report what they are doing in those regions in trying to understand and collect information for our planetary health, right? So this is more or less the idea that we have. Is the only way that we think we can be equitative in terms of health and also climate justice. Again, is trying to see the whole picture and not just what are the leading researchers in some of developed countries are doing and publishing.
Sure. And are you seeing, or do you hope to see more collaboration among researchers in the global North and global South?
Yeah, absolutely. That's also the aim. If you are publishing in our journal, for instance, you will start to see who is who and who is working on what. Young researchers that really are eager to work and collaborate with some Northern Hemisphere, for example, specific universities or institutions. This is an opportunity to do so, and it's a way that we can effectively communicate and to see who is working on in which aspect in those regions that we are looking for.
So with all this, how do you hope that advances in global health will contribute to conversations about climate change and climate justice in scholarly literature, as well as the mainstream, which I know is becoming so much more important, and I think something academics are thinking about more?
Yeah, so Danielle, here is where we need to know, going step by step. We need to first see how is the we are optimistic about the submission of new papers. So we need to be at this stage very patient about how we are moving and how we are putting attraction for new submissions. But in our future, how we see this, we see to create a community, a global community of researchers that get really engaged with our journal, with the help of our section editors. As I said, around the world, we have people from Edinburgh, Doherty Institute in Australia, Montpellier in France, even though they are from most developed countries, they all have research going on in different areas, part of the world that we want to focus our research. So we are all doing uh, uh, we are all creating a collaborative network. We also hope to make use of this virtual world that is after COVID or during COVID, and create some webinar for exchanging ideas. We want to bring the attention also from institutions from FAO or from Environmental Protection Agency from the United Nations, so we can together maybe also create thematics, webinars or workshop around the planetary health. We want to exchange ideas to create a new body of knowledge about planetary health, and to get a better understanding of what is the situation in our planet. We are in a crisis right now, and a food security crisis, environmental crisis, pandemic crisis, so political crisis. There are many things that's going on in our planet, and we believe that our journal will eventually progress toward those answers. The SDG goals were set at the 2030, so we just have 6 year. No, what we have 8 years from now, 7 actually, where we need to target those specific goals and get a better understanding of what's going on there. So that's our contribution. We are aiming to contribute to an understanding of planetary health in my section towards our sustainable development goals from the United Nations.
Sure. And it is so important to emphasize that we are the idea of 7 years to hit those goals. It's certainly a pressing time, and I think it can be a very stressful time for so many. So learning about exciting initiatives like this that are helping to move us forward and to hopefully, build a better world is really exciting. And I appreciate the chance to learn more about this journal. I know we're getting towards the end of our interview, so for a final question, I did want to ask you, what are you most excited about for the future of advances in global health? And also, too, certainly, if there are any updates that you would like to share, or calls for submissions or things like that, we welcome you to share that also.
Yes, so first thing is that check our website. That's an invitation for everybody, and the advances of global health in a very specific section, but there are also other sections that you will see in this kind of interview that are very useful to know the idea behind. So we will be posting soon a special collection on actually the 3 SDGs, so they are all very welcome. Again, there is individual information, so contact me in case that you want to know if your work is part of our aim or our scope. We have easy communication channels and very fluid, even in Twitter or by email. And the call is that we all need to contribute for our planet. And there are other journals that we probably, they are with higher impact factor, different scopes and time. But we are just starting, and we really are confident in creating a new community that explore the main issues behind those abandoned sometimes regions in our planet that have the answer for many of our problems and that we don't see often, or most of the time even. So it's an opportunity, it's a new channel, it's a new window to, it is still some time to cure our planet, hopefully, and with scientific answers, we can make it in our new journal. So very welcome for a new submission. Contact me. I can answer all of your questions. And that's invitation, Danielle.
For sure. And the way that this journal is bringing such a collaborative approach and a communal approach to publishing, I think will be so exciting for researchers. And I'm excited to follow the progression of it. I've enjoyed watching its development so far. So with that, I just want to say that it's been great learning more about advances in global health. This again is such a great platform for transdisciplinary research related to health equity, as well as to promoting, all of the sustainable development goals, including climate justice, as we're talking about this Open Access Week. So we encourage you to check out the journal, and if you have relevant research, to look into submitting. Thank you so much again, Dr. Mardones, for taking the time for this interview. Thanks to all for watching, and we wish you a wonderful Open Access Week.
Thank you, Danielle. Good to see you, and hi to everybody.